Today's session is going to be a good one. So, are you worried about learning anatomy? Well, don't fear, you're not on your own. With so much to learn, I think that clinical human anatomy can be a really daunting subject area. But the good news is that our session aims to provide a range of tips, golden rules, and techniques that are going to really help you to visualize and conceptualize clinical anatomy and enhance your learning, which sounds great to me. And we have a great teacher for you today in Professor Richard Tunstall. So before I hand over the reins, just a little bit about Richard. Professor Richard Tunstall is a professor of clinical anatomy and imaging at the University of Warwick and applied surgical anatomy lead, MRCS, OSCE examiner, and quality assurance group member at the Royal College of Surgeons in England. So I think it's fair to say you're in very safe hands today. He's also an internationally recognised editor and author and a section editor of the world-renowned Gray's Anatomy, both the 41st and the latest 42nd edition. And Richard has a wide range of expertise in medical and surgical education. So thank you again, Richard, in advance for agreeing to run this session for us today. And over to you.
Many thanks, and thank you for the introduction. So I'm just going to jump straight into this talk where we're going to look at some techniques involved in learning anatomy. I'll give you some tips as well and some golden rules. So as was mentioned, I work at the University of Warwick in the UK and for the Royal College of Surgeons, England. So I teach at many different levels. And when you're new to anatomy, it can appear like a daunting subject area. So what we're going to do in this session is have a look at, firstly, learning to learn clinical anatomy. So some tips and techniques for learning. And then we'll move on to have a look at some specific tips and methods for learning clinical anatomy. So there's 10 in the list here. We should get through all of these. If you wish to screenshot that list, just so you have a reference, please feel free to do so. So anatomy is a complex and information-rich subject. And for many new people to anatomy, new students, it's overwhelming. And indeed, for many of my students who've been with me for a year, it's still overwhelming. Take, for example, the lungs and the tracheobronchial tree. In this simple figure, it might seem simple, but watch the list on the left-hand side. This is a list of the official structures that sit within the tracheobronchial tree and lungs. So it keeps going, and it keeps going, and it keeps going. And yes, all of these structures can be found in the tracheobronchial tree and lungs. And this is one of the reasons why this is such a daunting subject area. So you need ways to break it down into bite-sized information that you can process. Let's first start by looking at learning to learn clinical anatomy. To begin with, it's important to realize that taking time to reflect on how your learning is best achieved and optimized is never wasted. Many learners don't take the time to do this, but this is a really good point to just reflect on how you're learning, what you've been told in the past, and what new techniques could work for you. So let's start with this. You may in the past have heard that you are a visual learner, or you're an auditory learner, kinesthetic, or a reading writing learner. The reality is that these historic notions of preferential learning style are actually incorrect, unhelpful, and unsupported by the evidence base. So you may think you have a preferred learning style. However, the reality is that your preference of learning style is completely unrelated to how well you can process information in that style. There's a lot of research being done on this and published on this, particularly recently. So one of the recent publications, and I do like this final conclusion from this publication, was that the conventional wisdom about learning styles should be rejected by educators and students. So really what this is saying to you is don't tie yourself to one style of learning. It's best for you to utilize a broad range of resources, techniques, and styles to help you to make the information your own. And I'll talk a bit more about how you can do that later. Also bear in mind that traditional lecture style teaching or information-rich resources are actually quite ineffective for driving learning. You might think they're helpful for learning because they make you feel good and because they look nice, but actually real learning takes more than just going to a lecture or just engaging with a resource. To learn something, you need to process the information, make it your own, test yourself. And it's that testing of yourself that's a key component. So real learning is rarely easy or quick. And I'm really sorry to tell you this, but it isn't. And even in anatomy, it won't be easy or quick. So prepare yourself for that. It's going to require quite a bit of effort. But aspects of struggle and uncertainty are essential parts of a learning process. And I think sometimes this is forgotten. So you might go onto Google and search for the answer to a question. You get the instant answer. You feel happy about that. But the reality is that you haven't had to struggle to get that information, so you are less likely to remember it. Therefore, quick learning wins are actually rarely beneficial. So bear that in mind when you're structuring how you start to learn anatomy as a subject. And do be aware that feelings of uncertainty and dissatisfaction within a learning process are completely normal. You will have some really good days. You're going to have some really tough, difficult days. You will feel dissatisfied sometimes, and that's okay. These are all feelings that you will go through. Some days you will think anatomy is impossible. Don't worry, it isn't. You will get there. Also remember this, don't assume that you know something just because you've seen, studied, or done it before. And here is a simple example that might help you to conceptualize this. Consider your hand and the back of your hand. So consider the back of your hand. Now put that hand, either left or right hand, out of view behind your back. Now, without looking, describe precisely 5 unique features on the back of your hidden hand. Now, some of you might think, well, I have a scar, I have a spot, I have a cut, I have a little freckle or mole. But can you precisely describe where it is? The back of your hand is something you see every day, multiple times a day. But the chances are you can't do this task because you have not actively studied, learned, and tested yourself on that. And if you want to prove that this works, over the next week, study the back of your hand, identify 5 unique features, test yourself daily, and by the end of the week, you will be able to do this. So remember, test yourself and identify and address your unknowns and repeat this cycle. So with clinical anatomy, and you can apply this to any other subject area, this is a useful process to remind yourself of. Review the learning objectives for your course. So make sure you know what the course is intended to achieve. Test yourself. So test yourself against those objectives. Then identify and address your unknowns, test yourself again, and repeat this process. Now, this might look obvious to some of you. To others of you, it might look like, well, I don't need to do that. I'll just learn what I'm told. But this process works. It's integrated into every teaching and learning opportunity that I provide, be it at school level, university level, or at the Royal College of Surgeons. So remember, for learning to occur, you must actively process and do something with the information and resources you receive. Don't just collect resources. Don't just search Google for resources. Don't just bookmark things. Do something with that information and make your own learning story from that information. Nobody else can do this for you. So let's have a look at some tips and methods which you can use when you start studying clinical anatomy. Number 1, take every opportunity to apply and test your anatomical learning or knowledge. So you will, of course, learn anatomy in lectures or seminars or in the lab with dissections, but it really goes beyond that. Clinical anatomy is not just about dissections. Clinical anatomy is woven throughout clinical or medical practice. Think about this. If you're doing an ECG on a patient, you need to know your anatomy. If you're examining the musculoskeletal system, if you're palpating a patient, if you're inspecting a patient, if you're listening to a patient's heart, if you're looking at a medical image or carrying out a medical procedure, all of these involve a knowledge of clinical anatomy. So you can be constantly testing yourself, reminding yourself of the core learning points associated with your course. Make sure you look for opportunities as well to practice and apply your clinical anatomy knowledge throughout your training. You can also do this in non-clinical settings. Now, this might sound quite strange to begin with, but you can practice your clinical anatomy knowledge and apply it in a non-clinical setting. So take this example. Set yourself a small daily learning objective or learning task. And in the example given, you could set yourself the task of learning the functions of the knee. So let's assume we're sat on the grass in the park with Alex. And you could ask yourself, which muscle group is flexing Alex's knee? Or you might even ask yourself the question, what is knee flexion? Now, if you're going to do this and you're talking to someone, do make sure you tell them what you're doing, otherwise it could look quite strange. But every opportunity you get, you can test yourself on your clinical anatomy learning and knowledge. Point 2, prioritize the learning of overarching anatomical principles and rules. And sometimes these might be referred to as threshold concepts. Mastering a threshold concept will allow you to quickly move to the next stage of learning. So throughout every subject area, there are threshold concepts. These are concepts where if you can understand that concept, suddenly it takes you to the next level and it will ease your learning journey. So let me give you an example. Every description of location within the body relates to what's known as the anatomical position. This subject is standing in the anatomical position. The position is the subject is stood, the feet are together, the hands are by the sides with the palms facing forwards, and the head is upright with the eyes looking forwards. So every description of location we have within the body relates to this standard reference position. And then from this position, we can define different areas or locations indicated by the blue arrows. This one, for example, indicating a more superior position in the body. The lower one down here, which is the opposite, representing an inferior position. And we can cut the body into specific planes. The blue plane cutting the body into a left and right half, this being sagittal, the green plane being the coronal plane, and the red or pink plane you can just see here, cutting the body into top and bottom halves, and this is known as the axial plane. So this is an overarching rule that you must understand prior to studying much of your anatomical content. Now, the threshold concept here is that the anatomical positional terminology remains unchanged no matter what the position of the body. So, for example, we may have a subject with their upper limbs abducted, so lifted away from the body, the elbows flexed and the fingers splayed. It doesn't matter. The anatomical positional terminology holds true. The same applies to a subject lying down, or a subject sat down, or a subject sort of lying at a 45-degree angle. It doesn't matter. The concept here is the anatomical position holds true no matter what the position of the body. So this is your standard language that you will use throughout your anatomical studies. One of the things that really confuses people to begin with, or daunts people, is the range of anatomical terms in use. It's really important that you begin to master anatomical naming and terminology. Don't be afraid of this, tackle it head on. And I'll give you some examples here of how this can be useful. So to learn clinical anatomy, you must learn a new language. You're going to learn thousands of new words. Understanding the origin of some of these anatomical terms will help you understand what they mean, and it will help you to visualize the anatomical structure that has that term applied to it. Here's just a few examples of some of the core terms that you really should get used to in the very early weeks of your study. So terms such as sub, upper, lower, proximal, distal, the term anastomosis here at the bottom. These all have specific meanings, and they can be applied across multiple different anatomical structures. Now, the early anatomists named structures in a relatively logical and simple manner. Now, you're not going to think this when you start studying anatomy, but they did. They named structures according to foods. If they look the same as a certain food that the anatomist ate, that's how they got named. Some structures were named according to their resemblance to a kitchen item, architecture, landscape, a person, a job, a plant, a pen, or even color. So you will see this throughout anatomical naming. And you might not believe it at this stage, but let's look at some examples. Here is a seahorse. The genus that seahorse belongs to is hippocampus. And some of you may have heard of the hippocampus. The hippocampus being a region of the brain. When we view that region in cross-section, it has the curled shape of a seahorse, hence its name. Another name you'll see anatomically is the salpinx. The word salpinx translates to trumpet. It was a very basic form of trumpet used in ancient Greece, where there was a simple mouthpiece, a long tube, and it flared out at the end. The anatomical structure that bears a resemblance to this is the uterine tube, which starts off narrow and flares out at the end. So you may see the term salpinx used in relation to the uterine tube. And you'll also probably, or you may have heard of the clinical procedure, a salpingectomy, which is a clinical procedure to remove the uterine tubes. Another example of a term relates to a plant or a tree. Now, when searching for clip art, I found this picture of a tree. It's a slightly horror movie looking tree, but the principle holds here. Look at the branches of this tree. The term ramus is used in anatomy. The term ramus means branch, and you'll see this term used across several different structure types, but mainly associated with nerves. So if we take the spinal nerves, you will read about their ventral and dorsal rami. That might look confusing. It simply means the back branch and the front branch. Here's another example. This is the hip joint. It's a ball and socket joint. The socket being this deep area here into which the ball fits. The early anatomists compared this socket to this bowl, and this is an ancient Roman glass bowl. This bowl was used to keep vinegar in, and it's known as an acetabulum. The word acetabulum means vinegar bowl. So the early anatomists saw this, they saw the socket shape of this vinegar bowl, and that's how they named the socket part of the hip joint. This is the acetabulum of the hip joint. Another example, this is the thyroid gland, this butterfly-shaped, pink, slightly fluffy, cloud-like looking structure here. The early anatomists thought, well, it looks like a shield covering the neck. And that's exactly what the word thyroid means. It means shield. They took it one stage further and said, well, there's two large sections on the left and right connected by this thinner piece of tissue. And they named that thinner piece of tissue the isthmus. The term isthmus really means a narrow strip of land that connects two land masses. A famous example of this is Panama. The country of Panama connects North America with South America. And sometimes this strip of land is known as the Isthmus of Panama. Also, anatomical naming involves stating the obvious. This is a photo into the top of the skull. We're looking at the skull base where the pointer is, and here is a big hole. And this is exactly what the early anatomists called it, foramen magnum, which means big hole. Here is an image of the spleen. Now, there's lots of vessels going into and coming out of the spleen, but many organs, the vessels to many organs, are named very logically, and if you state the obvious, you're probably going to be correct. So this is the splenic artery and the splenic vein. You might be interested in a couple of publications that describe a little bit more of the secret language of anatomy, so the etymology or the meaning of these terms. So here's two publications that you might be interested in, and many of my students actually do have a look at these because it does help them understand the basis of what could be or could look like some quite difficult or strange names. And be aware, some structures can have multiple names, and this isn't easy for you as new learners. Here's an example. There is a tube that connects the middle ear to the throat. You might know this tube as the eustachian tube. Many people do know this name, but it's also known as the pharyngotympanic tube, and it's also known as the auditory tube. This isn't really helpful for new learners. It's a lot of information. So your tutors and lecturers will give you a preferred term, but if you're uncertain and you want to check, then there is a useful web page known as TA2 Viewer. This is the official source of accepted anatomical terminology. It's free to use. You can just pop the name of the anatomical structure into the search box, and it will give you other terms that are also used for that structure. So number 4, when studying anatomy, there's a lot of detail. Learn the big things first and add the detail later. So I'm just going to use one example. This illustration is of the intestine or the gastrointestinal tract. Now, the illustration itself has been simplified. Nonetheless, it still looks complicated. It's still got lots of bits and lots of vessels going to it. Now, I could tell you all that detail at this point, but I won't. We can take a step back and look at the big picture. The gut tube can be separated into 3 regions. The foregut in this pink color up here, the midgut starting here in this orange color, and the hindgut in this brown color. So that's your gut tube. It consists of 3 big regions, and each of those regions has a blood supply that comes from a single big vessel. Those 3 big vessels are listed there on the right side of the screen. We can add one more piece of information to this. Each of these regions of the gut tube, the foregut, midgut, and hindgut, can have pathology affect them. And when a pathology affects them, it can cause pain. The patient will perceive pain in the abdominal wall, your tummy wall. And where they feel the pain will depend on which region of the gut tube is affected. So for example, if the foregut had pain in it, the patient feels, if the foregut had a pathology in it, the patient will feel pain in the green region. The midgut sends pain to the red region and the hindgut to the purple region. Now, you'll all have had an upset of your gastrointestinal tract at some point. Think about where you felt the pain. Now think about, okay, I felt the pain near my belly button. So now you know that, you know it came from the midgut. And if you know it came from the midgut, you can then start to add more detail later, trying to figure out which bit of intestine it came from. So remember, focus on the big things first, add layers of detail later. Something else you may find useful is to look for similarities in structure and design. So what's the similarity between the spleen, the liver, the lung, and the kidneys? Now, you may look at these and think they're totally different. And yes, in many ways they are. In function, they are. But they all have a similarity. That being that they are all formed from functionally independent segments. So what you see is a whole organ, but if you go anatomically down into the structure, you begin to see that they're formed from different segments that stick together to make the organ. Here's an example of the liver with its 8 different segments. And here's an example of one of the lungs, looking at the different segments colored up here. And lungs tend to have 9 or 10 segments altogether. So it's these kind of golden rules and principles that you can apply across organs, and this can make your learning easier. Next, look for shapes and patterns. Now, this might sound really simplistic, But this week, my new medical students started, my year ones, and this is what I've been telling them repeatedly. Just look for shapes and patterns. So here's an example of a drawing of the abdomen with the intestine in place. Look at the large intestine here, where the mouse pointer is. Look at the shape of that. Here's a dissection. This is one of my plastinated dissections showing the large intestine. Now look at the shape of it. What letter is that? And what letter is the sigmoid colon here? And if you look at them, it is as simple as it looks. The large intestine is N-shaped and the sigmoid colon is S-shaped. Remember that. Now look at the duodenum. This is the duodenum here, if you just look where the mouse pointer is. It has 4 different bits to it. Don't worry about that. Just look, it's got a curly shape to it. Here's a dissection of the duodenum. Again, here's the curly shape to it. What letter is this? Hopefully you can see it's a C shape. Now you might think, well, that's really simple. Gosh, how could that be useful? Well, it is. Here's 2 X-rays. If we look at these X-rays, initially they look complicated. You may never have studied an X-ray before, but follow the mouse pointer. Look at the gas pattern here in the colon. What shape or letter is this forming? And hopefully you can see it's an N shape. So we know this must be the large intestine. In the right-hand image, this is an image where contrast has been put into the gastrointestinal tract. Here we see a C shape. So we know this must be the duodenum. And you can apply this shape or pattern rule to pretty much any structure in the body, and you may need to just devise things that work for you. This is an arteriogram of some of the blood supply to the foregut. Look for the T shape. This is what I teach my students. They can identify the T, and if they know, they can see this upside down T shape, they know what they're looking at. I also strongly recommend you to draw your own conceptual diagrams or drawings. The example I'll use here is quite complicated. The organs within the abdomen are wrapped in a thin layer of tissue known as the peritoneum. And it does look complicated on this cross section and on this diagram here where there's multiple loops and the coverings wrap around all of them. But you yourself can think about, okay, what's the core principle here? And I'll show you a drawing. The core principle can be as simple as this. The body wall's in red, the intestines in yellow. We put some orientation markers on, and then we can draw on that covering layer here in blue. So you can do this yourself. You can devise these types of diagrams. You can then label up the different features to test yourself. And this again, this drawing you're looking at is a threshold concept. If you understand the basic principles being shown here, it lets you move to the next step of learning. So we encourage all of our learners to draw. We even have drawing sessions within our taught sessions within the university. This is how important and useful drawing is. Now, I won't dwell on this image, but this shows you the arterial tree of the upper and lower limbs and how they are incredibly similar. Just look how similar these are. You might not think so, but you can see a single vessel comes in, gives off a branch, pops over a joint, splits into 2. The lower limb vessels do the same. And then once they get down below the ankle or the wrist, the vessels curl around and join each other. So again, this is one of those areas where the similarity in pattern, but you can create yourself a really simple picture. And notice we haven't labeled anything at this point. I can, of course, add labels, and we will, and there's no need to talk about these here. But this is, again, about picking the big picture, adding the detail later. Look for patterns and look for shapes. Also look for golden rules. And golden rules can be used across different areas of the body. The example I'll show you here is a golden rule that tells you about the nerve supply and function of the muscles in the upper limb, or your arm as you may know it. There are many muscles in the upper limb. We're not going to name a single one of them here. All of the muscles in the limb are wrapped in a thick, deep connective tissue. Think of it as a jacket or like a strong bag wrapped around the muscles. On the left is the arm, on the right is the forearm. So that's the bit of your upper limb that leads down to your hand. Now, these are cross sections of the arm and forearm, and it shows us that both have an anterior compartment, that means at the front, and both have a posterior compartment, that means at the back. Now you can add some golden rules. Most of the muscles in the anterior compartment have a flexor function. And most of the muscles in the posterior compartment have an extensor function. Now, this doesn't hold true for everything, but this is a golden rule. It helps you just to simplify things down and say, okay, yeah, most muscles in the front compartment of the arm are flexor. So if they stopped working, you can then figure out what the patient consequence would be. And notice, we haven't named a single muscle, and yet you'll be able to figure out the problem for the patient if these muscles were to stop working. So they would lose some of the flexor function in their arm, which means they wouldn't be able to flex their elbow, or it would be a much weaker flexion of the elbow. You can then add more detail to these images by looking at the nerve supply. So I'll pop the nerve supplies on. And notice these really are golden rule based, and particularly in the forearm here. Don't worry about the detail, but this is one of those areas where you can apply a golden rule. So all of the muscles in the front of the forearm are supplied by what's known as the median nerve, with a couple of exceptions. So this is a golden rule with a couple of exceptions. But you could then, once you've studied this, once you've committed this to memory, then you go and learn about the names of the muscles, and it will make the process much easier for you. Final couple of points, and then I will finish and take questions. Embryology is a subject allied to anatomy. It is complicated. It can be quite daunting, but don't ignore it, because it will help you with the visualization of normal anatomy and pathologies. And here's one example of a pathology in the neck of two patients that's explained by embryology. You'll notice a small dot here, or hole, and this patient has a small dot on their right side, and the small dot on the left side is exuding cellular debris, which looks like a milky colored fluid. Embryology tells us why this happens. And I'm not going to tell you the detail of this. I'll just show you a summary picture. If you know the basic embryology of the neck and how it develops, it helps you understand how pathologies can occur in the green area in front of the ear, in the red area, in the yellow area, which is the pathology you have just seen, and in the blue area here. So please don't ignore embryology. It's really useful, particularly when you look at it in a clinical context. And finally, surface anatomy. Surface anatomy is more important than many people realize. That includes students and it includes tutors. It's often ignored by tutors and lecturers. It shouldn't be. It should form a fundamental core of what you study. Surface anatomy is referring to the surface projection of organs sitting underneath the skin. So on the left-hand picture, I'm just outlining the lung here. This is the right lung. Central picture is showing the position of the heart and some of the big vessels coming out of it. And the right-hand picture shows the position of the kidneys. Surface anatomy provides an alternative view of quite complex anatomy. It lets you see it on the patient's skin. It lets you see it in the way you're going to encounter it in most patients to begin with. You see their skin, you'll examine their skin, you'll examine organs through their skin. You can also practice surface identification on yourself. You have your own surface anatomy map or model. You can use yourself, but you can also use colleagues. And of course, you can use patients once you're in the clinical setting. But this is always accessible to you. Surface anatomy is also really key to help you understand and examine medical images. And in this example, this shows the comparison between surface anatomy on the right and a radiograph of the chest on the left. And I'll just give you one example here. The darker areas are the lungs. But now if we compare the surface anatomy picture to the radiograph, I'm just outlining a region on the radiograph here. I know this part of the lung is actually the top part of the lung, this area here, number 7, and that's known as the superior lobe of the lung. So if you can visualize surface anatomy, you can begin to better understand what you see on medical images. Thank you for listening. That's a brief but extensive, hopefully, coverage of some different techniques that you can take and apply, just to recognize where some of the images for this presentation were taken from. And I'll finish there and take any questions. Thank you.
Thank you, Richard. That was a really wonderful presentation, and what a great way, loads of great ways for students to visualize anatomy and remember and learn structures. I learned lots of interesting things. I didn't even know that there was such a thing as a vinegar bowl. And now
we did.
But we've got lots of questions, actually, if you wouldn't mind taking some for us.
Of course.
The first question that came in, would you recommend learning Latin prior to studying anatomy?
There's two answers to this question. No, I don't think you need to learn Latin, but it depends which country you are in, because some countries do teach anatomy in Latin. They use the Latin terminology. If you're in a country that does not use the Latin terminology, I wouldn't learn Latin. It's not worth spending your learning effort on that. But what I'd suggest is that you may want to get hold of one of the textbooks I showed that gives you the origin of the words. So it explains the basis of the words.
Thank you, Richard. That's really good advice. Another question here. I'm a third-year med student and I want to review my anatomy course that I took two years ago, but the content seems overwhelming. Where do I start, and how do I review it quickly in a way that I can remember it?
It's a very good question, and you're right. And I remember going through my clinical training years ago and having the same issue. You want to go back and look at anatomy and refresh it, but as a single unit of study that you possibly did just in your first year, it looked big. So think about what's important for clinical practice. Think about how you can incorporate that study into your clinical phase. So if, for example, you're on the cardiac ward, then think about, okay, this week, my tasks for anatomy are reviewing the surface anatomy of the heart and great vessels, looking in more detail at the structure of the heart, the valve system, looking at the coronary arteries and their territories. I'd also recommend, of course, that your course is being set by your course tutors and course leads. So do look back as well at the learning objectives that they provided you with, and you can use those to test yourself. So every learning objective should be written in such a way that you can turn it into an assessment question, and you can then test yourself. Ask yourself the question, can I satisfy this without looking? And you can use different techniques to do that. You can do it with friends, or you may wish to draw yourself pictures as well. I go on about this a lot, but if you can draw, you can apply knowledge.
Thank you, Richard. Just another question here. Is learning basic terminology, prefixes and suffixes, enough to understand anatomical terms more easily?
It's certainly helpful. It's certainly a very good place to start. I would start by learning positional terminology, so the terms superior, inferior, anterior, posterior. Learn the anatomical planes, so coronal, sagittal, axial. Then start to look at the prefixes and suffixes, because they are helpful. So when you see the term hypo something, hypochondrium, for example, hypo means under. So suddenly you've got an idea, okay, so this structure or this region is under something. Then we look at word chondrus or chondrocyte or chondra, referring to cartilage. So hypochondrium means under the cartilage. So yes, I'd certainly recommend learning, I wouldn't say all the prefixes and suffixes, but learn some of the common ones.
Great. There's a comment and a question here. Thank you so much, Richard, for the presentation. About testing, how often do we need to test ourselves? Because besides anatomy, there's tons of information from other courses to review. Also, is there a repository of questions we can access for anatomy?
So the question about how often to test yourself, the reality is all the time, but try not to think of a test as a multiple choice type question or as you having to answer an essay type question. Testing can be what we've just talked about. Just look at the learning objectives and in your head say, can I do that? And maybe make a quick sketch. Testing doesn't have to take much time either. So set yourself small bite-sized goals within a given week and say, I need to be able to satisfy these 3 learning objectives by Friday of this week. And within that, then you can map out what you need to do and how to test yourself. Or testing can be as simple as you have a look at a slide set that's been provided to you or a short video, and then cover it up and then see if you can actually write out the core points. Don't write out a transcript, but just jot down, what are the core learning points? What are the things I understand and don't understand? Just doing that simple task is also testing yourself. You're right, you have to balance this with other subject areas. And that's something that you've just got to figure out the way in which you can manage that best.
Thank you, Richard. Sorry, just another question here. Do you know of any resources that back engineer anatomical concepts, starting with pathology and working back to normal structure and functioning? I find it easier to process things in that way, but I don't know if it's helpful long-term to study it this way.
I think with learning and learning processes, you have to find what works for you. So I wouldn't worry about it not being the best way or appropriate way. I'll keep saying this as well, go back to the objectives. That's the one thing. If you can satisfy the learning objectives for your course, it doesn't matter how you get there or the route you take. If that route works for you and it's efficient, then use it. Your question's an interesting one. I think the short answer is yes, there are resources of that type, because there are resources that talk about anatomical structure, but in relation to an initial clinical case presentation. So there are certainly text book-based resources that do that. If you search for them, you'll find them. But they'll present a patient case to you with pathology included, and then they'll work back to looking at what the core anatomy is that helps you to understand that case or examine that patient. And I'm aware actually from the previous question, I didn't address part of that question, which was, are there any resources that you can use to test yourself for anatomy? Yeah, I mean, the short answer is yes. What I'd advise is that you try and prefer resources that are, should we say, written by experts and reviewed by experts, because there are many resources on the internet and it might seem like a quick and easy win. Many resources have been written by students. You just got to be a little bit careful, because the way questions are framed, the accuracy of content and the level of the questions may not reflect what's actually necessary for your course, or it may not be done in the best practice manner.
Richard, would you recommend that students start by speaking to their tutor in the anatomy department and asking what is actually available in their school, for example?
Yeah, absolutely. Yeah, I mean, always see what's available in your school, what the school has subscribed to. So they may have subscribed to publishers' resources. Yeah, so do that. See what's there and see what they might recommend for their course as well.
Great, thank you. So one here, do you think during classes not taking notes is more effective and then rereading and learning later on the day at home?
Yes, I do. I think it depends what the class is. So what I'm going to say, it may not apply to everything. But let's say you're in a class where you're being given information by someone, which is a bit more passive. It's often best just to listen. You may then want to just make a couple of notes. Don't note everything down that they say. It's really inefficient and it doesn't work. But you may want to just make a couple of notes for yourself, possibly about an overarching concept, or maybe just about the thing you need to go and look up afterwards to guide your learning and get you through the process. There is evidence to show that people who make copious notes, particularly in lectures, find it's a really inefficient way to go through a learning process, because you're simply just writing down information that you could probably get out of a book. So think about core concepts and the things you need to do or learn to get you to the next stage of the process.
Great, thank you. Do you have any recommendations regarding apps or literature?
Or literature as in books? So
I think it means books, yes. Yeah.
So in terms of books, find what works for you. And courses will recommend books. And in some cases, it's probably really important you use that book. But not every book or online ebook type resource works for everyone. It might be the way it's written is good for you. It might not be good for others. It might be some books present images for you that work for you because you need detail, whereas other people might actually benefit from a simple black and white line diagram. Both can achieve the same results. It's just the way they appear to different learners either is daunting or acceptable. So I'd suggest have a look at the range of different books available. Books recommended for your course are important, but possibly don't be tied down by that, particularly if it's not working for your learning process.
I just have one last question, and actually this is mine. What is your favourite anatomical term? Let's end on a high point.
Oh, that's fantastic. Really good question. I think one of my favourite terms is gubernaculum.
Ooh.
The term gubernaculum. So this is an embryological feature or structure, and it relates to the development of the gonads, so the testicles or ovaries. They start their life high up on the abdominal wall, but they have to descend to their final position.
Mm-hmm.
And to do that, they descend along this structure known as the gubernaculum. And the gubernaculum means the rudder or the governor. So the rudder of a ship or the governor of, I think they have gubernacular governors in the US. So it's a structure that guides or rudders the testicle or ovary down to their adult position. The reason I like it, though, is just how it sounds.
Yeah.
It's a great sounding word.
It's a great sounding word. That's amazing. Thank you, Richard. So really, I think all it remains for me to do is to say a really huge thank you to you, Richard. Really appreciate you giving us your time today to take everyone on the call through these really great hints and tips, ways to visualize anatomy. I think it's been incredibly useful. Thanks again, Richard, and thank you everyone for joining us. We look forward to seeing you soon.
Thanks very much.
Bye.
Bye-bye.